Go.
Yeah. Hello friends, today is 3rd March, World Hearing Day, and we are celebrating it as a National Hearing Week. So now hearing, as we all know, for overall development of a child or in our social, hearing is very important. Now let me talk about the hearing in child. As soon as the child is born, and if he is not hearing well, then there are a lot of problems that a child may face in the future. The common problem is his overall social development. Now here, the important thing which I would like to tell you all, as soon as the child is born, there is a simple hearing test can be done, which we call it as a OAE is the important test, which is a screening test for the hearing. This is done by the audiologist, and audiologist will guide the ENT doctor what exactly this OAE test is. Once the OAE test tells that the child is hearing normal, that's fine. But in the OAE test, if there is a doubt that the child's hearing is a problem, then the ideal test which a child should undergo, or the parent should take child to a audiologist and do the BERA. BERA is the most important test to diagnose the early hearing loss in a child. Depending on the BERA test result, whether the child is mild to moderate, moderate to severe, or severe to profound hearing loss, there are various treatment or the surgical intervention can be done. One of the commonest treatment, as we all know, are the hearing aids. Along with that, after the consultation of audiologist, whether this child should undergo surgical interventions like cochlear implant surgery or not, that will be decided by the audiologist and the ENT doctor. Now this is the common problem at present that we are facing, and early detection is not happening, and that's why a lot of children who can be really treated with the simple hearing aids or the surgical interventions, they go unnoticed, and then they develop a lot of problems for their education and their social life. There are other causes of hearing loss also. The commonest one are the cold which accumulates in the ear, and then the child or anybody may hear less, but that is a medically treatable disease. Now let me talk about the hearing problem in geriatric age group, say in adult patient. The common cause in, say, geriatric old age group is the hearing loss because of their nerve problem. So their hearing nerve becomes weak because of the aging, and then they get hearing problem. This hearing problem is easily treatable, again with the help of hearing aids. The audiologist will do the hearing test, and depending on their hearing problem, they advise the hearing aids. Hearing aids are also nowadays are like digital hearing aids, compatible with the mobile phones and easy to use. So hearing aid is the solution for the sensory neural hearing loss in geriatric age group. So this is what all about the hearing. There are other surgically treatable causes of hearing. For example, say there is a eardrum perforation, that is a tympanic membrane perforation, with the help of, say, surgical tympanoplasty. Because of, say, problem called as otosclerosis. Otosclerosis is a disease of a hearing chain, ossicle. The stapes, the third bone of hearing. The problem is because of that, and then we call it as a if I want to tell, there is a hearing chain which becomes immobile because of the otosclerosis, and the surgical option is there. The surgery is called as stapedotomy, with which the hearing can be resolved. So these are the commonest hearing problems with which patient comes to a ENT doctor, and with the help of audiologist, hearing problem can be easily solved. Thank you.